Vicky Karatzaferi, I'm a journalist, and I am going to moderate the upcoming discussion, which is entitled The Outside in Perspective for Innovation in Health. So, let me introduce you to our exceptional speakers. First, Mrs. Susanne Kohout, Country President and Managing Director, Novartis, Greece. Good morning, welcome. Mr. Ioannis Kotsiopoulos, Secretary General, Ministry of Health, Hellenic Republic. Kalimera, welcome. Mr. Andreas Pollner, CEO, Bayer, Greece. Good morning, welcome. And Mr. George Tousimis, Country Director, AMGEN, Greece and Cyprus. So, the term innovation in health has become associated with several developments in order to solve more problems. And in fact, the only thing that most people want, all people want actually, is to live a healthy life. And the innovation in health is a very crucial part of all that. The World Health Organization explains that health innovation improves the efficiency, the effectiveness, the quality, the sustainability, it's now a trend, the sustainability, the safety and the affordability of healthcare. And this definition includes new or improved health policies, new products, new services. Of course, we could add the patient satisfaction, the education, the access to healthcare. Let's keep that in mind. So simply put, the ultimate goal of health innovation is to improve the ability of all of us to have access in the healthcare system and for the healthcare systems to perform better. It's time to listen to our speakers. Please, Mrs. Kohout, you may begin.
So I think when we want to talk about innovation in all its facets, I think we should pause a little bit on COVID because it showed us a totally new world,
Definitely.
How to approach innovation. So I think the COVID-19 pandemic continues to disrupt everyday life and impacting all of us, jeopardizing businesses and putting healthcare systems under tremendous stress. But it has also, and that was the learning, I think, exacerbated existing problems of the health sector, and at the same time, it clearly highlighted the multiple interdependencies between society, health, the economy, science, politics, and the public and private sector. And it not only challenged the medical community to come up rapidly with new treatments and the vaccines, but it had also obvious the need of healthcare system to be adapting rapidly to incorporate innovation as of tomorrow. So I think COVID-19 was the fuel for a huge change in all areas of our lives, including health and business. And it violently changed the way we work, accelerated our actions, questions us to review practices, and set new priorities. So at Novartis, I would say we look at innovation in three facets. And the first layer for sure is the one innovation in our core business, the product and treatment pipeline. So we are a company with extraordinary history. And I'd like to recap a little bit, beginning with our origin in the dye-making market in the 17th, later evolving into chemicals into the 1800s. And then in the 1900s, discovering that we could use chemistry to improve health. And that we have continued to reimagine as a company ourselves every century. So in continued focus on innovation, Novartis has one of the richest pipelines and most competitive pipelines with more than 150 projects in clinical development. And here in Greece, we have 72 clinical trials running in 21, and more than 700 Greek patients are benefiting it. So today now we sit at the cusp of incredible advances in medical science, in medical innovation that we are leading. And over the last 5 years, we have seen the emergence of the most advanced medical technology platforms. And I'd like to mention three. So first of all, cell and gene therapies, something totally revolutionary. For example, in hematology for lymphoblastic leukemia lymphoma. or in rare diseases for treating spinal muscular atrophy from the birth of children, and ophthalmology for treating patients with loss of vision due to inherited retinal dystrophy. And what is the remarkable thing on these treatments? They cure, they not just treat. Then the next one is small interfering RNA. We heard a lot, RNA, what it all brought us for COVID. But we are looking into siRNA therapy for LDL-C reduction. Or also a totally new platform, radioligand therapy, for example, for prostate cancer. These technologies represent a paradigm shift in how we treat disease. And the pace at which the science is advancing is remarkable. And we expect many more treatments in the mid to long term, building on those technology platforms. And that the companies that we will win in the long run, along also with non-traditional players moving into the space, are companies that stay at the leading edge of these technologies. And rapid acceleration of artificial intelligence and digital in healthcare is a fact. And it is not a Novartis one, but the first artificial intelligence designed drug is currently in a clinical trial. Nobody could have imagined this, I would say, even 3 years ago. And the possibility to improve human life has never been greater. So this is a time, I think, for all of us to reimagine the way we introduce these therapies and platforms in the society, because it needs to be a rethink on all levels. And we believe it is also a shared responsibility. This is not only the industry, of all healthcare stakeholders, to help bridge the divide between those with access to critical healthcare innovation and those without. And development of and timely access to new medicines requires a strong innovation ecosystem. And Novartis is willing to play its part. And we foster really an environment that supports new approaches which can reflect the added value innovation bring to patients' unmet medical needs. And moving away of simple price-volume agreements to outcome-based negotiation reimbursement agreements. Now the second layer on innovation at Novartis is big data and digital transformation. So global health is data dependent. We have seen it with the COVID crisis. And big data is a great deal and great tool to understand, improve, and evolve our healthcare system. And I want really to congratulate. I think really Greece is very well positioned in this area due to its e-prescription system on one hand, and also its people capabilities. And by end of 2022, we expect there will be the full rollout of electronic health records, a digital ecosystem consolidating all patient records and metrics in one cloud source. And this digital transformation of the Greek healthcare will contribute further to the development and implementation of more sophisticated agreements and provide opportunities. And establishing a system which leverages data to generate meaningful insights, I think we have seen it in Israel, how they led the world in what it is all about COVID, I think, and will support decision-making and based on real-world evidence, and it's the most promising approach that I think will deliver the best patient outcome. So the development of EU-wide initiatives such as the RRF and the European health data space are a great opportunity which Greece should not be missed. And I think all the above gives us the opportunity to reinvent health and access here in Greece. Now, we as Novartis have already facilitated a project to explore the creation of a such health data use framework, because we need one, by transferring to our Greek reality international best practice, we can learn from Portugal, and with the assistance of well-respected academia. But we need to find a framework. And our aim is to really offer a pragmatic proposal for the benefit of the healthcare system in whole. The third facet is, today is the World Health Day, April 7th, and we sit here on stage. So the focus of the WHO is healthier tomorrow. And to reach this, we want to be healthier together. So this brings me to the third layer of focus, innovation in new partnership models. We have an opportunity and the responsibility to think totally different about how we bring medicine to people in a way that also helps manage broader challenges the healthcare system and the communities are facing. I think there are some very strong elements already in place that makes Greece a unique landscape for breakthrough solutions in disease management, with the number one being the Spiros Doxiadis National Health Plan. With this plan, it is for the first time ever that we have a written governmental commitment to implement public health programs at national level and primary and secondary prevention for enhancing the population well-being.
Mrs. Kohout, we should also check at the time.
Okay.
It's running.
CB risk factors, breast cancer and vaccination programs are stated at the top 3 priorities. To this direction, really, it is our example of partnership to tackle huge health programs. And we think that could be population health models, which are used by Novartis already in other countries, and really for ACVD. And that includes proactive identification of eligible patients and delivery of treatments. Another example worth sharing is the holistic care, and a hot topic for Greece, where we bring together primary care with specialists, bringing it together and facilitating the way, benefiting the patients. So I think it is the right time and our window of opportunity that we must fundamentally reimagine the way we work and create a culture that brings out the best of the Greek healthcare system to fulfill our purpose and reimagine medicine to improve and extend patients' life, which should be all our mission. Thank you.
Thank you very much, Ms. Kohout. I am unjustified. I just forgot to represent you to Mr. Andrea Celli, who is the General Manager, Philips, Italy, Israel, and Greece. Scusami, Mr. Celli. Please, you may start your speech.
I start. So, good morning, everyone. It is really great for me being here today. I'm very proud to represent Philips.
And forgive the journalist?
No, to represent Philips in an event such the Delphi Forum, which is actually very well known also outside Greece. So just a few words about Philips. We are among the top players in the medical healthcare industry. We design, we produce and deliver I would say meaningful innovation in high technology systems in the hospitals, such as magnetic resonance, computer tomography, ultrasound, angiograph systems, monitors, ventilators, and informatics solutions. We are present in more than 100 countries all over the world, and we invest around 10% of our turnover in R&D every year, which means about 2 billion euro every year in organic and inorganic growth. What is innovation for us in the healthcare? It is mainly addressing 2 challenges. The first one is fighting the obsolescence of the technological infrastructure in our hospital. Simplifying a lot, our hospital are made of human capital, people working in the hospital, such as clinicians, nurses, and the system they can use to work. We have great people in Greece working, giving their best every day in the hospital, so it is really important to give them the latest available technology to work with. And this is the first priority for us. Secondly, has been touched, is the digitalization of the healthcare system. We have to transform the way our citizens get access to the system and the way the clinician and the people working in the hospital support the patient journey. And this is very important through the digitalization. So I want to also reconnect to the COVID. We have all seen during the COVID peak as our hospital were not really equipped to react effectively to the crisis. What happened was that many people in a panic mood, as soon as they recognized symptoms, they moved to the hospital, and specifically in the emergency care units, which became immediately crowded and were the platform to spread the infection outside the hospital. So let's think what would happen if we had a strong telemedicine solution in place at that time. So we have to demonstrate that the lesson has been learned. And now we have a great opportunity, unrepeatable opportunity in front of us. I think I'm referring to the European Resilience and Recovery Plan. For Greece, the total value is around 30 billion, of which 1 billion is dedicated to healthcare. I would say only 1 billion, which is the 3% of the total expected spending. Just to give you an example, I know very well in Italy, the recovery fund is 200 billion, of which 20 billion, the 10% is dedicated to healthcare. So it means at the end of the program, Italy will invest 3 times in healthcare what is expected to be invested in Greece. And this is a pity from my point of view. So we said 2 challenges: fighting the obsolescence, giving to the human capital the systems at the latest possible technology. This is immediately an improvement in productivity. I focus on diagnosis systems. We can do more scan in less time, and we can do what we call first time right, precision diagnosis. It means having just 1 scan without need to repeat it if you have the right technology. Secondly, we were discussing about digitalization. Let's think about telemedicine, teleconsulting, telemonitoring, even interoperability among different hospitals or inside the same hospital among different departments. It would help a lot in collecting data and having this large, very large amount of data available for government to apply the so-called artificial intelligence and having the first step in building the predictive medicine. It seems like a dream, but it's not a matter of availability of the solution. Solutions are available. It's just a matter of adopting the solution. And to adopt this kind of solution, it is really needed to establish a very strong dialogue between all the stakeholders involved in this transformation. With stakeholder, I mean association, private companies, university, hospitals, public decision makers. We need to be all together because this transformation is really made of different layers. There is a structural, infrastructural layer, human layer, technological layer, and cultural layer. So the only way to win is to share competencies, know-hows, skills all together and influencing each other and what is better to do. So summarizing, I try to stay in my 7 minutes. Summarizing, I think that we have 2 challenges. The technological challenge, we have to renovate, to replace the old system that are now installed in our hospital. And the second one is the digitalization, and we have also the fund to do it right now, thanks to the European Resilience and Recovery Fund.
Thank you very much. Grazie tanto. Scusami again. Mr. Pollner, please.
Thank you very much. And first of all, many thanks for being invited to this wonderful panel, because I think what we see when we look at innovation and the outside-in view, I believe there are 2 perspectives. Greece is an innovating country in healthcare, so the outside-in view might be also how to leverage more what is happening in Greece when it comes to innovation. What we clearly saw, and I think Susanne mentioned that COVID had in many ways a catalytic impact for us, especially in the healthcare sector, but also in the change of behavior between patients, doctors, and also the whole ecosystem that's relevant for healthcare. So what we do in Bayer is mostly that we want to look along the patient journey and putting the patient in the center. What innovation is necessary where to improve the patient journey, to improve also the way how the optimal healthcare can be provided by the HCPs to the patients. I think what we should not underestimate is we have a dramatic situation when it comes to identifying the needs of patients and support the HCPs in their work. For sure, what we have is a core business of driving innovation in research and development. I think this is always the core and the center of pharmaceutical companies. On the other hand, what we also see, and I think what also the colleague from Philips mentioned, is it is not something that can be a standalone. What we see is it starts, for example, with the diagnostic activities. Maybe some of you are aware that roughly 40 million wrong diagnoses are done by radiologists per year. Not because the radiologists are not very qualified doctors, but it is also a huge load of work, complex work, and what we've seen is that in many hospitals and centers, this is not a connected system. So this is, for example, a part where AI technologies, big data, plus the collaboration between the stakeholders will help to drive a software approach which allows to support the radiologists to reduce their mistakes and errors and improve, for example, the start of the journey for the treatment. This is extremely important. What we believe is that when we look at the development of new drugs, it comes to a different collaboration. We invest a lot in clinical trials. We also built a clinical trial academy together with Medical Society of Athens and our partner Alpen in Greece, because we believe that clinical trials as part of the innovation is a driver for a better healthcare approach. And what we've seen is if you don't start in that part, if you don't also bring all the innovation to Greece and leverage this from the quality of data generation in clinical trials, then we will not be able to have fast and reliable development of drugs. Another element which is very important is from our point of view, we need to open up in a way how we collaborate with different stakeholders. And in the session before we talked about digital health. Digital health is very central for us in Bayer and also for us in Bayer and Greece. We have started to build up a program which we call the Healthcare Accelerator, which is an umbrella initiative where we bring clinical trial and hospital activities, patient care, and also the expertise of HCPs in the center. We believe that it is extremely necessary to bring the different partners together, patients, healthcare specialists, but also then the supporting tools to ensure that we have a better care for patients. So we work, for example, with universities when it comes to the point to improve remote diagnostic activities in ophthalmology. Or we've started a program with a number of universities in taking care when it comes to thrombosis management, where the patients are, after the start of the treatment, in the responsibility. However, this is not easy. And we heard in the session before, the literacy of patients, but also doctors when it comes to digital apps or digital applications is still low. This is something where we need to support them. Otherwise, it will be not possible for them to engage in the right way and also to get the highest benefit out of these innovations. I think another part is we have seen that now the government has done a lot to create a legal framework that allows private institutions and governmental, hospital, university institutions to collaborate, to build spin-offs, which then allow also to look into digital business models. I strongly believe in this, that we can create there a win-win solution which drives innovation. And this is something where I believe we then don't bring the innovation from the outside, we generate together innovation in the Greek healthcare market. These dialogues are, from our perspective, extremely fruitful and possible. I was and am still very impressed how many academic institutions, research and development activities in Greece are open for collaboration with the industry, and this is something which we systematically are fostering. So from my point of view is, I think if we want to improve the whole patient journey and the disease management for patients in a more efficient way, we have to go along these different steps. There are wonderful examples and innovative elements that we are now leveraging. I think this needs this continued joint effort by government, academia, and the private institutions and industry to drive this forward. So it is tedious, it's not easy. However, we should not be getting tired in doing so, because it's in the end the right way for the patients to increase the health overall. So thanks a lot.
Thank you, Mr. Pollner. Mr. Tousimis, we're ready to hear your point of view.
Well, thank you very much, and I think it's very exciting times for all of us. Looking to the future, I think it's very exciting to be in the area of biotechnology. And I'm saying that because we have two different factors which are impacting this. On the one side, the need for innovative medicines, and on the other side, our ability to innovate, are both expanding dramatically as we speak. If we talk about the need for innovative medicines, it's clear that the aging population issue is a major driver for that. We have right now 700 million people over 65 around the world, and another 150 million people will be turning 65 by the end of the decade. When we focus in Greece, we have 2.3 million over 65, and another 1.2 getting close to 65 in the years to come. And you know, what is very interesting is that those people are the ones who tend to consume 3 times more than the rest of the population when it comes to healthcare. It's evident that the conditions linked with age are very alarming for all of us. And we have to talk about the cardiovascular disease, about osteoporosis, about cancer. Now, if we go into these specific areas, let's take cardiovascular disease. Despite all the advancements of the recent past, in the last 2 decades, I think we've seen miracles happening in this area. We still have 1/3 of all deaths coming from cardiovascular disease. And 85% of those deaths are attributed either to a heart attack or to a stroke. Now, if we talk about osteoporosis, for example, we have more than 200 million people out there who are suffering from osteoporosis. In Greece, the number is roughly 650,000 people suffering from it. And in our country, we have more than 85,000 fractures every year because of this osteoporotic condition. This costs to the system more than 750 million euros every year. Now, when we talk about cancer, obviously, again, we have lots of advancements in cancer in the recent years. Nevertheless, we have, on an annual basis, more than 10 million people dying of cancer, and the 5-year survival rate globally is less than 70%. In Greece, things are even worse. The 5-year survival rate is less than 60%. So I think that, yes, the need for innovative medicines is there, and it's evident, despite what has been done in the recent past. Now, obviously, COVID is a major example, and Ms. Kohout referred to it before. It's clear that it has understandably overshadowed everything in the past 2 years. But the serious diseases have not gone away. And as we get over this specific crisis, we have to ensure that we take the right measures to tackle all the issues that the society will eventually have and still has. Now, let me talk about the ability to innovate, and that's what makes it very exciting. Well, the ability to innovate is definitely driven by the science and technology. If we look at COVID, it took us 200 years, more or less, to understand as humanity the mechanism behind measles. It looks, self-explainable right now, but it wasn't many, many years ago. But it took us only 2 weeks to analyze in full the genome of COVID-19 virus. And this enabled us to come up with solutions, be it vaccine or medicines, to deal with the pandemic and be here in Delphi with physical presence as we speak. Of course, data is king, as we say, and there's lots of discussions happening, and we've seen it in the panel before. Lots of the presenters in this panel referred to it. And the source of data and the amount of data available is becoming more and more. AMGEN acquired 10 years ago, back in 2012, a company called Decode Genetics based in Iceland. This enabled us to gain access to genetic information of more than 100,000 people living in Iceland. And throughout these years, up until today, this number is growing. And right now, we have access to genetic information of more than 2.5 million volunteers around the globe. This has been becoming possible because of the advancements in technology and the ability to gather and maintain this data at low cost. Now, we now have in our company more than 100 petabytes of human data, and this is 10 to the power of 15. This is a vast amount of data, and that number is growing as we speak. This data, they yield powerful insights into biology and disease, and they inform virtually all our platforms, all our research efforts in clinical development, increasing the chances of success. It has also made it possible for us to invest heavily in what we call multi-specific drugs. Drugs who have different ways of behaving depending on the human body which they come in contact with. And that gives us an opportunity to tackle potentially 85% of those disease-causing targets which so far were treated or handled as undruggable, as we call it. So believe that these type of medicines, they have the potential to revolutionize healthcare in the same way that biologics did 40 years ago. We are really getting close to that point in time where we will have the right treatment for the right patient at the right time. And you know, we don't really need to rely on Mother Nature so much anymore to understand how a protein works. We can build the protein from scratch, and we can be more or less confident that it will predictably perform a desired function. So it's really early days, but having deployed these new technological insights, we are reducing our discovery timelines by half, and we are doubling our success rates. So it's a very exciting process, and I think that we are now able to operate at what we call the speed of tomorrow.
Thank you very much. So, Mr. Kotsiopoulos, you represent the Greek government. We would like to hear your point of view on this subject.
Thank you, and thank you for giving me the opportunity to be invited and speak in such a great conference, and obviously having the opportunity to hear the opinions of the industry, which is really powerful, and I think I'm not going to add too much to the discussion.
I'm sure you're going to after.
We all heard some great insight from the industry, and I think the government is really aligned to what the industry needs. But before we get to that point, let me take an opportunity to reflect a little bit on what happened over the last 2 years. We're now given a window of opportunity to be here without masks. We are enjoying some freedom, but obviously the pandemic has not gone away, right? So we all need to think about how to build resilient and sustainable healthcare system as a whole. And I think doing that, not just as a country, but as a European Union. One of the big lessons learned, if I'm allowed to say that, is that we should be working together more as member states, working together with the industry, with all the stakeholders, to prepare for the next, perhaps, financial crisis or pandemics or whatever lies ahead that we don't know. Now, over the last 2 years, we managed to fight, due to the advances in technology, a very dangerous virus. We're not at the end yet, but we've learned how to collaborate. We learned how to use technology. We learned as a government to use more technology, and everyone in this room and everyone who kind of is listening to us right now has seen the advances that the Greek government has made in the area of digitalization. But clearly we need to do more. And if I may say, the Recovery and Resilience Fund is a tremendous opportunity for the Greek healthcare system to advance and also address the challenges of the future. I was going to start by saying Greece has many challenges ahead because of an aging population, and you kindly refer to that, and we shouldn't ignore that. Obviously, advances in technology, new treatments, drugs, new therapies are going to be needed by the population. The population will want to have access to these new drugs that will improve their life expectancy, will improve quality of life. So somehow we need to find the resources to do that. Now, innovation is a solution because not only we can improve the healthcare outcomes, but we can also save money, but by introducing new models of care. As you said before, if we had used telemedicine 2 years ago, or if telemedicine or teleconsultation or electronic prescription from home was available from the start, we wouldn't have crowded ED departments, which meant that the virus wouldn't have spread so quickly. So we all need to reflect that. We all need to kind of take some time to design, with the money that we have from the Recovery and Resilience Fund, a new healthcare system, a new healthcare map, as we would like to refer to that in the government, that is kind of addressing the needs of the population. So if I may say, because the time is quite limited and we spent a lot of time talking about these things, the government, especially kind of the General Secretariat that I'm working at, has been working on 3, let's say, areas. One is digitization. We shouldn't be referring to things that we've done. I think most of you already know that.
What were we expecting? I think it's the more interesting.
Exactly. So we have designed a very ambitious program in terms of e-health. This is available to all of you to read, and the philosophy of this new program for e-health, or for digital health, as we would like to refer to it, is an ecosystem of products, of software tools that can interoperate, and at the heart of it is healthcare data, the healthcare data that we need to make advances in technology. As you kindly refer to that, we have petabytes of data, but we don't necessarily have access to the data right now as we speak. And the reason that we don't have access is because we don't have the appropriate clinical systems embedded within our hospitals right now in Greece to enable clinicians through some tablet applications to capture the data at the place where they work, instead of fighting to find a PC somewhere hidden in a corner. So we all need to reflect on how our clinicians work, the pressure that they are in, the kind of the environment that they have to work at, the pace that they have to work at. So all of these things need to be reflected on the way we bring technology into the hospitals, right? And not the other way around. We shouldn't be pushing clinicians to use solutions that are made in a lab without taking into account reality. So at the heart of our digital transformation is the improvements on clinical information systems. And all the data will be collected within the National Digital Patient Record. And we will open the discussion for how can we make best use of the data as a kind of secondary use of information for research and development. So that's the first pillar. The second pillar is how do we buy products and services from the industry? What are the procurement mechanisms available right now? And how do we need to advance procurement mechanisms and buy not just products and services, but patient outcomes, or buy the entire patient journey? And that's actually the question. How do we work with the industry to make use of the data that we will collect, to design new procurement models? And this is where I personally need more input from the industry, and I'm sure that we're going to have that because we have been working very closely together over the last 2 years. Now, I know that the time is very limited, but let me get to the third and also very important sector, which is patient safety and quality. We've been used to measuring how many people have been hospitalized instead of measuring what are the patient outcomes of the patients that have been hospitalized, how many falls have we prevented, how many okay, you'll help me with that.
You know, all the unkind germs that hit you once you were in the intensive care.
Okay, so you all know what I mean. So how do we measure that, and what are the actions that we can take to make sure that we offer better patient safety and better outcomes for our patients? Now we have introduced some legislation and new organization to do that. So the P is, for the first time in the Greek healthcare system, one organization that can actually control patient quality, monitor patient quality, and help us design better policies, better healthcare policies. Now, AOP, which is kind of our insurance mechanism, right, can use the data for the quality data to buy the best services that they can from the private and the public sector to offer best services to the population. We've seen that over the last few months that the collaboration between private and public sector was needed to overcome the challenges of the pandemic. Let's design a new system that's based on that collaboration, based on the quality of the services that are actually provided independently. And some of the expertise that we cannot find within the public sector, we can actually buy the expertise from the private sector. There's nothing wrong with that. I know I could be talking for a while, but let's
have a look at the time, because...
All right, so if I round it up, I think that the last thing we should be doing is find better ways to compensate innovation. Right now, we have been compensating, as I said before, products. Let's find different ways to compensate innovation within the products and patient outcomes. Thank you.
Thank you very much. I will start my questions from you, though. Do you think that the hospital managers, doctors, and nurses are really ready to adapt innovation and follow the rules in order to have a better everyday life while they're working? Are they ready to support it?
I think it's a brilliant question because, especially when we're talking about healthcare services, people are the kind of not only at the receiving end, but also kind of the people that will make the difference. They are the nurses and clinicians and the hospital managers that should drive innovation. And I think we should, there are a few obstacles to that. First of all is, right now we don't have the right incentives, right? So what's in for me for bringing innovation to my department? So we need to change the culture and we need to be working with the people, and I think OVP as an organization is mandated to do that, go around Greece and push people to think differently and push people to change the way they work and work with them to bring innovation. The same applies to hospital managers. We are changing the way we evaluate how hospital manager works. We will be bringing in new contracts with hospital managers that are more strict and more kind of in line with the agenda that we have, which is a completely different agenda. So we'll be, I think, pushing a lot general managers, hospital managers to bring in innovation. And the third thing is that also we need to find ways to improve the way clinical trials are carried out within the hospital environment.
It's a major issue.
It's a major issue, and we'll need a lot of time to do that. So I'll leave you to that, but there are things happening within that sector. You'll see them announced shortly.
Oh, okay. We can't wait about that. So, Mr. Celli, Signor Celli, could you tell us the differences between Greece and Italy about innovation, I mean?
Yeah, I do not see, frankly, a lot of differences. As I was saying before, maybe Italy is focusing much more...
First major difference, the money, you said.
Yeah, focusing much more on healthcare.
3% and 10%, remember right?
Fund, because we recognized it was one of our weak points during the COVID crisis. And the same for digitalization. I think that the Greek public healthcare system is comparable to the Italian one, so it needs a lot to be digitalized. And I see a lot of comparison in terms of the risk that we are facing today. I see many risks in implementing the European recovery plan for both, for Italy and for Greece. With risk, I mean, for instance, the cost rising that we are facing today, the inflation. We have to state very clear that the 1 billion you agreed 1 year ago doesn't worth the same today. This is a problem for what all the plan that
stops the progress, you mean, and the whole process.
Yeah. Secondly, we have supply constraints, global supply constraints, above all in electronic components, which even if we will be very fast in tendering, very innovative in tendering, then we could risk a lot to have delays due to the supply chain. So the company won't be able to deliver what they promised during the tendering phase. Third, we have a geopolitical situation which is very risky. I'm referring to Ukraine, not only in terms of energy cost increase, but also it could push government in moving some funds from healthcare, from social, to military spending. And this is a risk for the healthcare systems. Then we have risk in tendering, maybe, public tenders, procurement could be still very traditional, as you were saying before. So no value for money, no KPI to measure, how the company are delivering. And the last is more we digitalize the system, more we are exposed to cyber attack. So we have to invest also in cyber security to protect our networks. So this is a lot of risk that we need to...
Lots of challenges.
A lot of challenges, and that we have to work all together in order to mitigate them, and they are exactly the same in Italy, in Greece, but I would say are the same for the European Union countries.
Thank you very much. Mrs. Kohout, I would like to ask you, do you believe, since you are quite a few years here in Greece, that our country has a fertile ground for innovation to grow and flourish? And if not, what is missing?
I think that I like this question very much.
Thank you.
And I like to illustrate it on the COVID management. I think illustrated on the COVID management. I think the management of lockdown, the whole SMS campaign, we like it or not like it, as well as the not to become patient Eleftheria campaign. I think we're mind-blowing.
About the vaccination, you mean, yes.
We're mind-blowing, and I think when I reported back to my friends in Germany or to Switzerland, it was really, they couldn't believe it. Even Germany to date cannot say how many patients are vaccinated. I think Greece set an example. And when I say the 5 years I'm living here in Greece, what really, one lesson I learned, if there is a will, there are means here in Greece. Now, what does it mean for us as a healthcare industry also to make it happen? I think we can do better. And I think we need really to make the business environment and more manageable and predictable. But what the COVID crisis showed us, there are 3 requisites for me. So first of all, mutual sense of urgency to make things happen and fast decision making. I think that was clearly shown here in the COVID management. So removing bureaucratic barriers and burdensome processes. If there's a will, also the different bodies in the government, everything can come together and make it happen. But there need to be the will and the sense of urgency. It's now the time to make this happen. So I think to move faster from theory to practice, if I may say. The second one is, for me, a clearly defined framework for innovation and a clear roadmap. So as pharma industry, I think we can contribute to a substantial plan to establish a modern and innovative healthcare system. But for that to happen, there needs to be not only a vision, there needs to be a clear path with milestone, and really close progress monitoring is required and changes to happen on the way. So from a vision to come to a clear roadmap. And last but not least, I think a well-defined long-term goal with clear accountabilities. And I think strong leadership is required, and I think it is really, with the Minister of Health, we should have it together with other departments. And I think it is required to implement reforms to minimize market distortion. After 10 years, we talk here about clawback. Since not all stakeholders are on the table, I think we will never solve it here for Greece. And promote a patient-centric approach. I think like the electronic health record. And what you said, how we use the data, that we get to outcome-based instead of just providing drugs to the patient. So I think it needs a strong requirement, full alignment of all stakeholders sitting on the table. And I think the window of opportunity we have is really, it's time for all of us to rewrite a new social contract for health where all stakeholders are aligned and committed on key priorities, but also their obligations. So I think there is really a virtual ground for innovation, and I think it's up to us to make it happen. Thank you.
Thank you. Mr. Pollner, could you please tell me how far or how close are we to adapt innovation in health in our everyday lives? Because I think that's the big question here. It's all good in theory, but you have to load it down in order to have a better life. What do you think?
I think that's absolutely true, and we heard this already in several elements.
Yes.
However, it starts, I think, also in the way how we start with what we develop. So I was very happy to hear also the reflected view from the government, Mr. Kotsiopoulos, because I think co-creation is extremely important in this. So if we develop something that maybe technologically is fantastic, but not as used and doesn't simplify for patients, caregivers, or doctors their activities, then it's useless. So we drive very much from co-creating activities. I think there are a lot of barriers at the moment. We try in some of our programs and projects to start basically from the users. And when we're looking in Greece, we see very much that patient organizations know what they need, doctors know what they need, and we have to bring that together, and that's what we are doing. So we are there on a journey. We are not there yet. On the other hand, what we also saw is the acceptance of devices, sensors, has dramatically improved over the past 5-6 years. We've seen that technology is much more precise. We've seen that we have, basically everybody has integrated tools like smartphones and others to use these. So many of us get minutely reminders. If somebody has a smartwatch, they tell you when to stand up because you were sitting too long. I mean, it is getting in a way that is much more usable. On the other hand, what we as also pharma industry have to do to build the trust with the users and the authorities that when we use all these data, that this is firstly protected, but secondly also used to drive the outcomes really. And outcome-driven models, I'm very happy to hear about this, also need a different approach on how we would like to look at prices there. Sometimes these tools and centers are seen as very elite. They're quite expensive sometimes still. However, I believe it needs to have an access for all. Health for all is for us a clear vision in the company. So how can we drive this further? And there we are not on a very advanced route. So what we would wish is that we also work closer there in a more agile way to test some of these ways in an ecosystem where we then can also apply this fast, develop even with governmental institutions together what would be the prices. We don't need to have then separated fiercely price negotiations. It would be much more easier than to understand how do we access this and then provide there to a broader audience these activities. I mean, we heard about the increasing aging of the population. We know that this will have a dramatic impact on the cost of the healthcare system. We have to start now.
A lot of illnesses show up more often than they used to be.
And you can start now for the whole system when it comes to caregiving, medication, so the whole spectrum of disease management from products but also services. And this is where we really need to advance. And I'm happy to hear there are a lot of promising and encouraging signals, and this is what we would like to take up also together as an industry.
Mr. Tousimis, I would like to hear your point of view. What do you think are the keys to success?
Well, I couldn't agree more with what Susanne said before about, you know, where there's a will, there's a way, right? And we were able to do that in Greece. But, you know, it's not only that. We have to understand that we have to value innovation for what it brings and understand the urgency behind supporting it. But at the end of the day, we cannot do it on our own. I think the key word for the future is competition. So we can't just compete between us. We have to collaborate. I'd like to give one example which is very tangible. It's called Optima Oncology. So they say, you know, it takes two to tango, but in this case, it's 36 who are, you know, maneuvering together around Europe. We have major universities around Europe. We have major pharma companies. Some of them are part of this panel today. We have scientific societies, the most important ones in Europe, data providers, high-tech companies, research institutes, you name it. And we also have the European Cancer Patient Association in this, you know, initiative, who are all sharing the same vision to revolutionize cancer care in the next years, ensuring that patients can have access to the best up-to-date possible treatment, utilizing what we can get out of artificial intelligence and real-world data. And this initiative is now under the umbrella of the European Union, the European Commission. It's getting funded. It is utilizing more than 3 million of human data, the biggest amount of data available right now as we speak in Europe, sorry. And what's fascinating about it is that Greece is part of it. There are Greek institutes who are participating in this initiative, right? So I think that we have to work together, and by doing so, by understanding that it's not a matter of the government or the universities or the pharma industry, it's all of us working together, embracing innovation, not creating obstacles for it, and working together towards a common goal.
Thank you very much. And last questions in the 3.5 minutes left. Mr. Kotsiopoulos, for you. Okay. It is said that regulations prevent innovation. Do you agree?
Well, yes and no. The answer is that regulations are actually needed to make sure that everyone is safe, that we keep the certain kind of rules that have to be applied. But also regulations can be updated, and we can also, as a government, improve things where we have to.
Is it easy to update the law? I think it's a major process.
It is a major process,
it's not easy.
But I don't think it's the main obstacle for innovation in Greece, regulation. I think there are quite a few obstacles, as we kind of referred to before. And for example, we refer to people and the kind of and the incentives they have. We refer to the governance of the system. So we need to improve the governance of the Greek healthcare system, which is now quite aging, and we need to move towards new models of governance instead of kind of looking at hospitals per se, looking at the whole pathway and looking at kind of integrated care systems, ACOs. All these things are happening abroad, and we need to kind of bring that knowledge in Greece. So when we look into accountable care organizations, these are the kind of, they have the framework and the bandwidth to give people the opportunity to invest in innovative solutions. But hospitals themselves, acting alone, I think they're quite restrictive. So we also have bureaucracy being in the middle, and I think regulations sometimes do tend to kind of create bureaucracy, but we need to look at where are the obstacles, and digitization is an answer to that. So in order to, we've seen that time and time again over the last 2 years, we removed barriers by introducing digital solutions, e-prescription, but
if you allow me, although Mr. Kotsiopoulos, some would like to say that you, let's say, digitalized bureaucracy in a way. What do you think about that?
No, because I would actually disagree to that, because the way that we design solutions with the Ministry of Digital Governance is that we think digital first. digital first means that you scrap everything and you start by designing a new, completely new solution that is completely digital. We don't digitalize bureaucracy. This is wrong. And wherever that has been done is wrong. So digital first is the way we should be moving forward.
Eager for the future then. Thank you so all very much.
Thank you.
Thank you, ladies and gentlemen.